As a physiotherapist, TEND is one of my favourite devices for treating low back pain, and that includes let me show you a few of my favourite tricks. So first we have to switch it on, click the end a couple of times to move up to level 2 or 3, and then place the TEND right where you feel like your pain comes from. And once we've found that tender spot, we can do a couple of things. First is just hold the TEND to that spot, and that's going to deliver focal vibration therapy. That does an amazing job of helping the muscle to relax by interfering with the neural responses that it's given. So once I've got that in there, just holding it can do a load of good, but then I can start to gently lengthen like so, or shorten like this to try and just hit that sweet spot where I get the most feedback from the tool for the least amount of pressure. That's what I'm after. And then I can just stay in that position for 20 seconds to a minute or so. Usually after that length of time, you're better to move on to another area. Once we've held the tool on that spot for a little, what we can then do is combine that with movement. So if this is my worst spot and this is my worst movement, what I want to do is see whether the vibration from the TEND can work to run a kind of interference while I'm making the movement. And what you'll often see is while the vibration's on the sore spot, you can get more movement for less pain. And if you repeat that often, then you can really start to move in towards recovery.